If the knee becomes contracted, so you can't straighten it, or it becomes so stiff that you can't correct the deformity, then a total knee replacement is required or recommended. Now, what a total knee replacement does, it essentially removes all the structures within the knee. So what happens during a total knee replacement is conventionally the surgeons will use manual jigs, which will be placed through rods in the thigh bone and rods or manual devices on the outside of the shin bone. So the surgeon will then cut the surface on the top of the tibia, which gives you a flat surface, and the surgeon will cut the bone on the femur, and then essentially components are placed on the tibia and the femur, and they form a knee replacement. So let me just show you that. This is the type of knee replacement that we're using at the moment, and you can see here it consists of a femoral component, tibial component. So let's go back a couple of steps and see how it's done. So we take this off. So the surgeon will essentially cut the bone flat on the tibia. That's the first cut. Then the surgeon will cut the bone around the thigh bone there, and you can see that. On the femur, a femoral component is placed. On the tibia, a tibial component is placed. So this is a typical tibial component, which consists of a titanium base plate and a polyethylene insert, plastic insert. So that will be taken and that will be positioned into the bone like that. That forms the lower half of the construct. Then on the top of the joint, we take the femoral component, which is again a titanium implant which we use, and that's impacted on, and then that forms your new joint. Now, there's an 80% satisfaction with knee replacement surgery. We tend to say to patients that there's a prolonged recovery, in most cases, 80% satisfaction. So out of the 20% who are not totally satisfied, 15% are still better than before, but they may have some residual stiffness, or the knee may feel numb, or they may feel a bit of grating or clicking, but they're still better than before. 5% of people develop a more major complication. Knee may become more totally stiff. They may develop an infection, which can be low grade or high grade. It can be superficial or deep. And sometimes that requires everything to be washed out or taken out. There's a risk of thrombosis, and there's a risk of, in some cases, instability of the knee. This leads us on to the discussion, how should the knee replacement be done? Conventionally, most surgeons are using jigs to make the cuts and to size the components. And during the operation, it's very important that the flexion gap, the bend of the knee, is equal to the extension gap, the extension. In other words, if you're able to straighten your knee and not able to bend it, that's going to cause you poor function. And likewise, if you can bend it, but you haven't got enough space to straighten the knee, that's going to cause bigger problems.